My name is Dr. Corey Fearhiley. I'm an emergency room doctor and I am the Director of Emergency Services here at Post-Acute Medical. One of the more common situations where I might recommend someone to return to inpatient rehab here at Post-Acute Medical would be a bounce-back patient who might have undergone a procedure such as a coronary artery bypass grafting. These patients are usually in the hospital for several days and sometimes weeks before they're able to be discharged. And although they may be offered inpatient rehab, a lot of these patients just want to return home. A few hours goes by and they understand that they have made a poor decision, that their pain is uncontrolled, and that they're going to be unable to complete the tasks that might help them recover fully. At that point, they wind up back in an emergency room such as mine and are asking for pain control and potentially readmission. When patients bounce back to the emergency room, they incur several costs all over again. They incur a cost for returning to the emergency room, they return a cost being readmitted to the hospital. So what would happen at that point is that I might contact a patient navigator working for Post-Acute Medical who would come into the emergency room at my request, do an evaluation there, save the hospital a readmission, and that patient would be transferred from the emergency room directly to inpatient rehab. The resources available at a dedicated inpatient rehab facility such as Post-Acute Medical far exceeds what's available at most hospitals. This allows patients an opportunity to come here and regain function before they return home.
My name is Teresa Bishop. I'm a patient here at Post-Acute Medical. I am so glad that I can get continuing care until I'm all better, because it's a hard, long road to being able to walk again. And they got me going so quickly, and I would never pass up a chance to get recovery here. It's no good being at the hospital and being immobile. And if you are a person that needs continuing care, take it, work hard and do it, because it's so worth it to get back to your regular self. My experience here at Post-Acute Medical has been amazing.
My name is Dr. Justin Chavez. I'm the lead physiatrist here. I'm also a pain management doctor. Whenever we get an ER patient referral, we're always looking to try and work with their family, and not only their family, but also their community physician. So we oftentimes reach out to their community physicians for any data that we can gather on the patient before they ended up in the ER. We also work with the therapists here, occupational speech and physical therapy, to try and see what issues they might have at home that might have led them to come to the ER so abruptly, whether that's pain or weakness or simply falling. We try to address those issues through adaptive equipment and or medications if we need to. Because we have so many specialists here, including internal medicine, speech therapy, respiratory therapy, and wound care, we're able to meet just about any need that comes from the ER and help those patients to stay home.